Hello, and welcome to Let's Talk Midlife Crisis with your hosts,
Ashley
and Tracy. Pull up a chair for your seat at the table as we talk about with Paige. Welcome back, Paige.
Thank you. Thanks for having me again.
It's always nice to have you here.
Always nice. And today we're going to talk about aging skin.
Perfect.
Yeah. And so we were just talking a few minutes ago that I had found something on social media about skin stamping, which is basically an at-home microneedling, and just wanted to pass it by you to see what you thought about it.
Yeah. So to backtrack a little bit, what microneedling is you're creating micro wounds in the skin on purpose. And the whole purpose of that is just to go past the epidermis, which is the first layer of your skin. The needles go down to the dermis, which is where all the collagen and elastin is. And so making those wounds will then help generate new growth. So it's kind of like an analogy that I've heard from one of my educators when I was in school was like aerating the grass.
Oh, yeah. Okay.
So like you take off the first layer, you go down to make it all regrowth. You go down to the roots and just kind of make it all come back better. So it'll help with elastin, collagen, fine lines and wrinkles. People use it to get rid of like surgical scars, stretch marks, things like that.
Acne scars.
Yeah, a lot of things. Nice. They can do it all over your body. It doesn't have to just be your face. So if you have like stretch marks on your stomach, your thighs, anything like that. Yeah.
I didn't know that.
I didn't either.
Yeah. So it can be used anywhere on the body.
Okay.
And then to answer your question about the skin stamping, my professional advice is always never to do anything like that at home.
Right.
But you technically could, you just won't see that great of results because usually the brand that I think is the best is called Skin Pen. There's a lot of other brands, professional brands out there. They all usually range from 0.25 millimeters to like 3 millimeters. So the skin stamping probably isn't going deep enough into your skin to actually cause effects and benefits from it.
Oh, interesting. So does it hurt at all? Because I'm thinking like all those little needles going in my skin.
I've done it before and it does. I don't want to say it hurts. I think it's just a matter of opinion, but it doesn't feel good.
Yeah.
Okay.
And I kind of, it's kind of like people with tattoos. Some people say it hurts really bad, and some people are like, oh, it's not that bad. You know, it just,
and I think no ink. So,
yeah.
So I don't want to.
So it really, I think, just depends on your pain tolerance, but it definitely is not something that's like necessarily relaxing.
Right.
Right.
And again, it's needles, you know, they're going in, so you can imagine, you know, and I've never done anything like, what's the therapy they use with the needles? Acupuncture. I've never done that.
And that's where this
that
actually stemmed from.
Oh, is it?
Microneedling came like in the history, it came from originally like acupuncture and stuff like that. That's where they got the idea to do it. Yeah.
Okay. So it might depend on the device, but how many needles are actually in there?
It does depend on the device. Usually so it's like a really tiny circle. There's probably about like 15 to 20. And then you turn it on so it just goes like in and out of the skin. And then you can change the depth. So how far it's going into the skin. So like forehead, you may not want to go too deep just because there's not really a lot of density
and the needles, they're really thin.
Really
they're
thin,
not
yes.
thick. Okay.
And a lot of estheticians or medical professionals, whoever's providing the treatment, will use numbing cream before, which you got to.
I did.
Yeah.
Yes. Yeah. She did put something on my face before. One of the things that I found really interesting was, and I think most people do this, estheticians do this, some don't, from what I understand. So after they do that, obviously you have some blood on your face. It's not like you're pouring out blood or anything.
It's like pinpoint bleeding, which is good. You should your goal is to try and get to the pinpoint bleeding.
Yeah. And she actually, when she finished, rubbed the blood all over my face and then sent me, I lived very close, blocks away, and then sent me home for an hour. And then I went back to finish my treatment. And it does something, the blood, I guess, is good. It does something for your skin. What was it?
So there's like a vampire facial, which is like PRP. And this is just kind of like a lesser version of that.
Okay.
So once you have the moist skin and the open pores, your blood on your skin has a lot of platelets and like growth factors in it. So then it enters into those holes deeper.
Okay.
When it comes to microneedling by itself, the blood is kind of like, I've seen a lot of mixed reviews on it. Some people say like it's not worth it, it doesn't provide results. Other people are very big on it and say like it's better to just have it there and hope that it does something. Compared to like PRP, where they're actually drawing blood from you, putting it into a centrifuge, separating the platelets from it.
Wow.
And then microneedling that into your skin. So it's like fertilizer. If you go back to like the analogy I was using, it's like putting fertilizer and then pushing that into your skin, which is the benefits from that are, I mean, a lot better, obviously, and you would probably need less sessions compared to microneedling.
Okay.
Oh my goodness. So
I never even heard of that before. So.
I haven't either. So if you were to get a vampire facial, is your esthetician also a phlebotomist? Like they can draw blood?
So for that, you usually go, sometimes they have nurses working or like a nurse as an esthetician. One of the girls I went to esthetician school was just like, it was a stopping point for her esthetician school. She was going to be a nurse. So she could provide those facials along with pulling blood.
Wow.
So I'm thinking maybe like the medical spas versus the luxury spas you would find in a resort.
Although I do know in Arizona, one of my friends went to just phlebotomy school, I guess. And she's an esthetician, so but now she can pull blood at the same time. And then her boss has some medical degree, so she can pull the blood. The boss does the other part, and then she'll finish off the facial with.
Interesting.
Wow.
Yeah.
Wow, that is interesting.
So why would you want to do, I mean, I'm assuming it's more expensive.
Yep.
And I'm assuming that people that are willing to spend that money and want to do that kind of treatment probably have severe scarring or...
It could be a range of things. They could probably, severe scarring, acne scarring, maybe just aging, fine lines and wrinkles. They want to get deeper and things like that.
Now. I haven't, as we all know, I have never had any plastic surgery on my face. I've never had Botox or fillers. And I love the sun. So I just always thought, well, I'll wait till much later in life if I am going to do that. But recently, just the wrinkles. The amount of wrinkles is, pushing me to the point where...
It's starting to surface.
Yeah, it's like, okay, it's time to do something. If you're going to do it, it's time to do something now. And so I'm looking into that as opposed to... I just don't like the way Botox and fillers make
a more natural
look.
choice, I feel like.
So...
it also could help with pore size. So if you have like enlarged pores, getting it... putting the holes into that and then having them shrink that appear smaller, as well as like sunspots and hyperpigmentation. That's another reason. If you have dark spots on your face, whether it's from aging or hyperpigmentation from the sun or anything like that, poking the holes into that breaks up the color as well. And so it can come back faded. And the more you get it done, it could actually get rid of hyperpigmentation on your face.
Is there any reason that you couldn't do the treatment? Are there like conditions or anything like that that would...
Yeah, so there are some contraindications, which are just like, they use it in the esthetician world. It just means like people who shouldn't get it done. If you're pregnant, I've read that you shouldn't get it done. I'm not sure exactly what it is because of that.
Interesting.
If you have any sort of like autoimmune disorder or immune system or healing issue, like maybe you heal, like type 2 diabetics, they heal a lot slower. Some do, not all of them, but that could be a side effect of type 2 diabetes. Would never recommend it for them because their face isn't healing at a normal process. So it could kind of go backwards and just not be a good situation. But microneedling is good for people of all skin colors, so this could be good for them if they have acne scars and things like that, as opposed to lasers, because lasers could actually cause hypo or hyperpigmentation. So microneedling is a better choice for people of all skin colors.
I never even thought about
that.
And
the recovery though, because obviously you don't right after want to go into the sun or anything like that, but I think it's only just like 2 days, right?
Yeah, it's very minimal. By the next morning, if you are leaving the blood on your face or if you are getting PRP facials, you leave the plasma on your face for at least 24 hours, they say. And that's a clear, so you don't look, it's not like the blood. It's clear.
Yeah, I remember it just being kind of like a pink tint.
Yes. And then once you wipe that off, you may be a little swollen or red, but like you said, but then 48 hours, 72 hours, it should definitely be gone.
So it's not even as evasive as the peels.
Oh, no.
Some of those,
chemical peels.
Yeah, you could go to work the next day. I think I went to work the next day. It's not noticeable. If anything, it looked like maybe my face was a little sunburned, but nothing
or a
serious.
little, maybe even just a little puffy.
Yeah,
and I remember once that all went away, my skin did feel a lot more firm and soft, and I noticed a
difference.
But I did it one time, and to my understanding, it's typically something that you would need to do several times, and then maybe just keep up on it.
How many times would be optimal if you were someone like me that's really trying to get rid of, and it's maybe more than the fine lines and wrinkles right now, right?
I'd say about 4 sessions to see. I mean, you're definitely going to see results along the way. 4 sessions is usually like the area that they say if you need more after, you can always go back and then kind of just make it a maintenance thing. So like if you see maybe your discoloration's coming back or something like that, then you can go and keep up with it for maintenance reasons.
Okay, so 4 times. And how often do you go? Maybe once a month, or?
I think they recommend, when I was in school, we did 4 to 6 weeks.
Okay.
Yeah, depending. And if they have any issues or anything, you could always make it longer, things like that.
Oh, that's awesome.
Oh, I forgot. Another reason you should not get it done is if you have maybe you have herpes around your mouth and you're having an outbreak, wait until the outbreak goes away. Active pimples, you never want to microneedle over. Okay. So if you have active acne at the time, push it off and your esthetician should be able to see that and just be like, yeah, let's wait a couple weeks until it goes down, because then you're microneedling all the bacteria and stuff and moving it around your face, and it's open pores, so it's just gonna make everything a lot worse.
Oh wow.
Yeah.
Okay. Yeah.
Yeah, that makes sense. So you said you could do it anywhere on your body. What about, and I feel like this would be really painful, but I would love to try it. What about your chest?
Yeah, you can do it on your chest.
Obviously like that bone might not feel as great,
Yeah.
That skin is very thin. I imagine it would be a little more painful than your face, but, I'm finding my décolleté is, it's redder than it used to be.
Mine too. And I was going to ask about rosacea, because I have rosacea, so that's not a problem for microneedling. Okay.
No.
And I wonder, would it help at all, or?
Yeah, you said that you noticed some benefits from.
That's why I did it. Yeah, because I started getting a little rosacea, and I did just one treatment notice an improvement.
Right. Because I think on the chest and the décolleté in that area that I have a lot of red as well.
Yeah.
So. Yeah, I come to get used to it.
And it's 3 millimeters is the deepest it would go. And so it's, especially if you have numbing cream on you, you're really not going to, maybe like on the collarbones, but also I feel like you wouldn't really go over the collarbones. It's more like around
feel it. Kind of hit the bone, not necessarily hit the bone, but you know.
Yeah, we're all touching on it.
But yeah, I think the numbing cream helped immensely. I've not done it without, so I don't think
a lot of people offer it without. I mean, some people even offer like if it's a medical facility, like laughing gas and stuff like that.
Oh, yeah. I would like that.
I don't remember the last time I had laughing gas.
I used to get it at the dentist, but I don't think they offer it.
I don't think they do
for whatever reason.
Yeah,
it's probably not good for you, but whatever.
I'm sure.
A lot of get Botox and fillers too. I've seen people offer it in their offices too, for just Botox and fillers. I shouldn't say just Botox and fillers. Some people, depends on the person.
Right. And again, I have never had it, so I wouldn't know, but that's interesting. Most everybody that I know has had Botox.
Yeah.
At least, and perhaps fillers too. And I know a lot of people that had their lips done, but clearly I don't need that.
So what is the difference between Botox and fillers?
So Botox is more of like you're freezing the muscles in the area. So if you get it in your forehead, you're freezing that area so you don't have like, when you frown or make facial expressions, it's not moving as much. Right. Filler is more so whether somebody has like is losing density in their skin, maybe their skin is sagging, things like that. You put filler in the area so it like plumps it up and then kind of like brings it back.
Oh, interesting.
So, okay. So it's filler. So like underneath your eyes and stuff, if you are having like sagging, you'll put filler here and it just kind of like plumps the skin and like, because if you think of more like youthful, like not puffy is not that the right word, but like plump skin, right? That's what you're doing. You're kind of like filling the skin back up to that.
And when you get it done, like do you have to go back and get more? Is it something that over time will go away?
Yes.
Okay.
Yeah. Wow. I'm not sure how often. I've never gotten Botox and fillers either.
Days-ish, like 3 to 4 months from the women that I know that have it done. Yeah. Maybe even 6 months, up to 6 months. I think it would depend upon the person.
And I think the more you get it, the more you can go longer without it. Yeah. Yeah. And fillers can be dissolved. So if you ever have like a really bad experience with fillers, you can get them dissolved. Of course, you have to go back and spend more money, but
right.
Oh, that's true. Yeah. That's true. And I do seem to be now aging more sensitive to different things.
Yeah.
You know, products, I can't wear SPF at all on my face or my chest. So to know that you can take it out is comforting. But I just think of all of those, like Priscilla Presley, and you don't recognize them. And it's just, I don't know. I want to age gracefully, but yet you still have some vanity, right?
And if you find a good provider too, like some people are very, very conscious of like, we'll do a little bit here and a little bit there. See how you feel about that. Come back and we'll change it. And then some people, I've even had my friends that have gotten it done say, like, they told me, like, I'm not going to do any more to you. Or, like,
wow.
So there's some people that are very ethical about it out there.
Good.
Yeah.
They all should be.
They should, I agree.
My older sister does Botox on her 11, you know, the 2 lines between your eyebrows, and her crow's feet. And she looks great. It doesn't, I mean, she definitely still has facial expressions. And so I think, you know, if you're doing it in moderation, it's not going to look too crazy.
Right.
But I'm kind of with you, Tracy. I feel a little weird about injecting things into my body like that.
Yeah, exactly. Yeah.
And it's probably more affordable to do Botox than do, you know, the microneedling, and especially if you have to, you know, do it 4 times.
Right.
But ultimately, to me, it just seems safer.
Yeah,
and it makes more sense to do something more natural.
I was going to say, it seems more natural, which poking needles in your face perhaps doesn't even sound natural. I feel like it does. It might be a natural alternative.
Yeah.
And something because, you know, I'm using all these creams and eye patches and, you know, you name it, eye gels and different things. But I want that dramatic change.
Right.
You know, I'm looking for something that you can definitely see the result.
Yeah, and I think that, you know, those things are just kind of a temporary fix.
Yeah.
You might notice results right after you take your eye patch off, but by the end of the day,
that's what I was
it's
back.
back.
Exactly. And as well as some of the creams, you know, like in the morning and I put it on and I think, oh, it looks good. But even, you know, by noon.
Or if you go a couple days without it, it's like, oh, now I'm completely back to square one where I was before I even started using the product and stuff like that. Yeah. But going back to what you said about the microneedling doesn't seem like natural and stuff. I mean, obviously it's not. You're causing those wounds to your skin on purpose, but then it is triggering just your natural healing process. So it is a little bit more natural than compared to like Botox fillers and things like that.
Right.
And then there's another type of microneedling called RF microneedling, which is radio frequency, which that one does involve lasers and is very, very painful. That one,
I would imagine.
Everyone I've seen get it done. We did it when I was in esthetician school, and one of my friends became a laser technician, and I've talked to her about it as well, and everyone uses laughing gas with that. Because you're not only are you microneedling your skin, but then around it is where the radio frequency comes in, so it's lasering around it while microneedling.
Wow. Oh my gosh, that sounds intense.
And that's totally different than red light therapy. Right? Is there a red light therapy thing or some kind of a light?
The light is red, so that is
that the same thing?
It may have the benefits from the red light as well, but red light therapy would just be like if you're just doing that, you're just putting the light on your face. There's no pain involved at all.
Right.
It kind of sounds like laser hair removal, like the laser.
Right.
We talked about that in one of our
very
episodes.
similar.
Last week I went. I had to do maintenance,
Right?
And apparently I haven't been back since 2018.
Wow.
So imagine that. No, it was horrible, and I waited until it was so bad I couldn't stand it. But it was funny talking to her. She said that I'll go probably through the end of the year, maybe into early next year, so the next 3 or 4 months. But then she said that now they recommend, and of course, she also said that their lasers are more powerful than they used to be, which is good because then hopefully it would take less time to achieve the same results. But also she said they recommend now going back like maybe, and she said December, January of every year, just on an annual basis as you age, because, you know, it's funny how the hair stops growing on your body. But yet it starts
on your face.
In every way possible. But so I didn't realize that.
Wow.
But, and it doesn't hurt. The laser to me doesn't hurt. It's funny because she was like, oh, testing it because I just did my chin and my lip. And she was like, oh, this might feel a pinch. And I thought, I don't feel anything.
Wow.
But, you know, the lip was a little different, but they also push air. There's air that comes out as well. So there's something unnatural about that going up your nose.
Right.
They
Distracts you a
kind
little
of
bit.
use the, what's it, the thing
popsicle
that the doctor,
stick.
to
tongue
try
compressor.
to block it. Exactly. But it still does go up. So I think that sensation was a little bit different, but it didn't hurt at all. It doesn't hurt. Yeah.
Okay.
And considering they said that the lasers are stronger now.
Yeah.
Because we just talked about that and the pain and stuff.
I've noticed that too about lasers. The stronger they get with technology and stuff, they're usually able to make it hurt less as well, which is a great thing.
Yeah, it is a great
That's
thing.
amazing.
Yeah.
Going back to the red light therapy, how would you benefit from that on your skin?
It helps a lot with circulation, inflammation, some discoloration as well. And there's a lot of benefits, I know, like for your mental health as well. I don't know too much about that, but I know there's a couple places around here that offer a red light therapy, almost like waiting room. So you pay extra, but then you get to like sit in there for 20 to 30 minutes before your treatment, and then you go in for your treatment.
Yeah. I've had it done on my neck and back, just, when I was going to the chiropractor and dealing with some issues that I had a lot of inflammation. Yeah. And I felt a difference.
You can buy some really cool like face and neck ones now. I think one's Omnilux. I think that's the brand that a lot of my esthetician friends have, and they just put it on at night when they're laying in bed watching TV because you can still see and stuff. So they just
are there different like voltages, or is there something specific that you should look for?
That's a good question. I don't know, but I do know that you should, if you have one with red and blue lighting, and then like red, blue separately, and then a mix of red and blue together. That's really good because the blue helps kill bacteria. So if you're struggling with acne or stuff like that, you can put that on your face, especially if you maybe pop your pimple or you have extractions or it's just really inflamed and like cystic under the skin.
I seem to suffer from blackheads more than anything.
Okay.
Than, full on pimples, but those darn blackheads.
Oh,
it's not like I don't exfoliate 3 times a week.
I know. You just
and yet
can't
they're still
avoid
there.
it.
It's like, but I also don't drink enough fluids. So I know that I'm not as hydrated as I should be, which also contributes, right? It's that hydration, how much it affects you.
Absolutely. So. And then one thing I just wanted to touch on quickly before we wrap up, we talked a little bit about the facial massaging.
Oh, right.
And that too, I think, is really beneficial.
For sure.
In a lot of ways.
So what it's called is a buccal massage, and they massage the inside and outside of your face. Oh. And so they'll kind of like put their hands in your mouth and then just like massage the area, and that helps with like circulation, blood flow.
Maybe even sinuses.
Sinuses.
My face a lot.
TMJ issues. So. It's really good a lot of people get it done kind of just for relaxation and massages. I have a couple friends that get it done for TMJ issues because they're all the buildup and fluid, and then drains through your lymph nodes. There's a lot. I know
when you do my facials and you're whether it's the soap or the lotion, whatever, when you massage right there at the back of my jaw, it's just heavenly.
So improved blood circulation, excessive fluid removal, reduced puffiness, tighter skin in the lower face. So if you're, I am experiencing it now. I'm not even 30 yet.
You start to notice, you're like, wait, why is this chin getting
It can help with reduced acne as well, because acne is like, obviously it's clogging your pores, and there can be a lot of buildup underneath the skin. So just getting that circulation flowing, things like that could help decrease tension in the lower face, reduce chronic pain, and then sinus discomfort as well. It does a lot with that.
It seems like it's a twofer, right? And it's a win-win.
I would pay just to get a facial massage.
Right. That's I've seen a lot more estheticians going and getting their certification in that, because it's like, to add that onto a facial treatment is heaven.
Absolutely, and you might as well make the extra money. If you're an esthetician.
I tend to add the scalp massage in as well, just because it's so relaxing at the end of your session.
I know a lot of massage places offer just a cranial massage. If you don't want a full body, or you can get the cranial. Which I'm sure, I would imagine that even your hair follicles benefit from that.
See, I was thinking that too, because as you age, and I am noticing it now, it's kind of scary, but the hair loss that you have.
And the texture.
With COVID, it was like, is this a COVID thing or is this aging? But either way, it doesn't matter. I know that I'm losing hair, and you can almost see.
And I think, too, the texture of your hair changes as you age. Mine's definitely, I wouldn't say it's more necessarily dry, but maybe more coarse and frizzy kind of.
Yeah, that happens too. You can even get PRP microneedling done to your scalp. Like a lot of men get it done when they start to men or women can get it done. Yeah. But if you start thinning your hair, because the circulation, you're going, because sometimes when people are losing hair, it's not necessarily that there actually is no hair there. There are a lot of things could affect just the circulation of the blood flow,
Right.
which then causes less hair growth. So the microneedling, they're going back in, poking those little holes to get it to like re-stimulate, and then putting the blood into to just help with that as well.
Wow,
Yeah.
that's amazing.
Yeah. Wow. Well, as always, it's just wonderful to have you here, Paige.
Thank you.
We can't get enough of
I
skincare
know. I could do this
tips
every
and-
week.
And it's always changing. So
It is
It
always
is.
changing.
Yeah.
It is always changing. But thank you so much.
Yeah,
and
you're
we know
welcome.
that you're going to Italy.
yes.
Within a couple weeks. So
I
have a
know.
wonderful time.
Thank you. Yes, I'm very excited. Thank you for having me.
And we look forward to you coming back again.
Yes, absolutely.
And that just about wraps it up for today. Thank you for joining us on Let's Talk Midlife Crisis. Embrace the change.
Join the conversation on our website at letstalkmidlifecrisis.com or our Facebook or Instagram and YouTube channels. We'd love to hear from you guys.